Senator Brouk on the resolution.
Thank you, Mr. President. And I also want to thank my Senate colleagues, the Majority Leader Andrea Stewart-Cousins, for the support in introducing this resolution. Today is the first time in New York State that we are recognizing Maternal Health Awareness Day. The American College of Obstetricians and Gynecologists, also known as ACOG, began recognizing this day in 2016. It is now recognized across the country, and today we finally recognize it in New York. But in order to fully grasp the need for a day like today, we must first understand the state of maternal health in this state and in this country. For those who don't know, the United States has the highest maternal mortality rate in the developed world. And as so many other health conditions in this country, it is Black mothers who are suffering the worst, who are 4 times more likely to die during childbirth than white non-Hispanic mothers, even when controlling for factors like education level, income, or access to quality health care. In my hometown in Monroe County, where I represent, the maternal mortality rate is 46% higher than the national average and 54% higher than the rest of the state. I've got a lot of colleagues here from New York City. You should know, according to the New York City Department of Health, Black women are 9 times more likely to die from pregnancy-related causes. So what does this mean? It means for me and a lot of women who look like me, the prospect of giving birth is both terrifying and daunting in this country. It means that for every expecting mother who walks into a hospital pregnant, they wonder if we'll be walking out healthy with a healthy baby. Bringing a child into this world on your terms when you want to should be one of the most joy-filled times in our lives. But for too many of us, that joy is robbed. That's on us as leaders. We have to do better to support maternal health in New York. We have to do better for Shamani Gibson, who died at age 30, 13 days after giving birth. For Amber Rose Isaac, 26, who died due to complications from an emergency C-section. For Shasia Washington, 16, who died after undergoing a C-section. For Denise Williams, 29, who died just days after seeking postpartum care for pulmonary embolism. And so many people whose stories we haven't heard. I hope this resolution does more than memorializes a day for us to be aware of maternal health in this state, but that it is a moment to move into action. Let's pass legislation that addresses the maternal mental health crisis in this state. Let's support the expansion of life-saving doula care in our budget process. And let's please remember the names of not just these women, but all of the birthing people who are suffering in our country and our state, and let's honor them by taking action. Thank you.